Have you ever just stopped and thought about your hands? I mean, really thought about them. They're pretty incredible. They're basically our main tools for, well, everything. How we work, how we create, how we connect with people. But because we use them all the time, they're also one of the first places to send up a flare when something's not quite right. Okay, let's dive into this.
So think about it for a second. That weird numbness you get in your fingertips sometimes, or a sudden sharp pain, or maybe that stiffness you feel when you first wake up. These aren't just random little annoyances. It's actually a language. It's your body's way of telling you, hey, pay attention to this. The trick is just learning how to listen. So, in this explainer, we're going to decode that language. We'll start with the signals themselves, the symptoms. Then we'll look at conditions you can be born with, the ones that show up after a lifetime of use, and even some that kind of seem to pop up out of nowhere. And then, most importantly, we'll talk about what you can actually do to help. All right, so what are the most common messages our hands try to send us? Let's get familiar with these signals, starting with the ones that show up most often. You know the feeling, right? Maybe it's that pins and needles tingling that wakes you up at night, or swelling that makes your rings suddenly feel way too tight. Or maybe it's just a sudden weakness when you try to open a jar. Every single one of these feelings is a clue. They're the starting point for figuring out a whole range of different conditions. Now, not all hand conditions are from, wear and tear. Some are there right from the very beginning. We call these congenital hand differences, which is just a way of saying they're variations in how a hand formed before birth. And you might be surprised at how common this is. It happens in about 1 out of every 600 live births. These differences can be really minor, or they can be pretty significant, affecting both how the hand looks and how it works. So, to make sense of all these variations, doctors group them into different categories based on how they happened. The core idea is actually pretty simple. Some conditions happen because parts of the hand just didn't form completely. Others, like something called syndactyly, happen when parts that are supposed to separate, like your fingers, stay connected or webbed. And you can see from these images, there's a huge range in how these differences can present. But here's the most important thing to remember. No matter what the specific difference is, the goal of any treatment is always to maximize the hand's function, to help a person use it as best they can throughout their whole life. Okay, let's switch gears. We've talked about conditions you're born with. Now let's get into the ones that develop over a lifetime. All those years of gripping, typing, lifting, all the little things we do with our hands can really add up and lead to some super common issues. Okay, so take trigger finger. This affects about 2% of people, and it's even more common in women and folks with diabetes. It's that really frustrating, sometimes painful feeling where your finger gets stuck in a bent position and then pop, it suddenly snaps straight. I love this analogy. It makes it so easy to understand what's going on. Picture the tendon in your finger like a rope, and it has to pass through this tiny little tunnel, which is called a pulley. So when that tendon gets swollen or inflamed, it's too thick to glide smoothly through the tunnel. It gets stuck, and that's what causes that painful triggering. And of course, another classic result of wear and tear is carpal tunnel syndrome. This is probably the one you've heard of. It happens when a major nerve in your wrist gets squeezed or compressed, and that leads to that all too familiar numbness and tingling, especially in your thumb, index, and middle fingers. It's almost always linked to doing the same hand motions over and over again. And of course, there's osteoarthritis. As we get older, that cushiony cartilage in our joints starts to wear down. When this happens in your hands, you get that deep, aching pain, stiffness that's usually way worse in the morning, and you might notice you just don't have the grip strength you used to. Suddenly, opening a jar becomes a real battle. But what about when hand problems just show up, without a clear reason, like getting older or a specific injury? Well, some conditions send signals that can feel a lot more mysterious. Raynaud's is a perfect example of this. It's basically a massive overreaction by your blood vessels to cold or even stress. The little arteries in your fingers just spasm and clamp down, cutting off blood flow. And when that happens, your fingers turn this stark, ghostly white, then a spooky blue, before finally flushing bright red as the blood rushes back in. It's pretty dramatic. And the things that can trigger it are totally normal, everyday things. Just reaching into the freezer, walking into an air-conditioned building, or even having a stressful moment can be enough to set off a whole episode for someone with Raynaud's. So, have you ever noticed a weird, firm little lump on your wrist or hand? There's a good chance it's something called a ganglion cyst. Now, they can look kind of alarming, but here's the most important thing to know. They are completely 100% benign. They're not cancerous. They're really just little balloons filled with joint fluid that have kind of pushed their way out from a joint. And if you were ever wondering what's inside one of these things, well, this quote from a medical source is surprisingly vivid. When a doctor drains one, the fluid that comes out is super thick and has been compared to everything from honey to, well, to snot. Yeah, definitely a detail you won't forget.
Okay, so we've listened to the signals, we've explored some of the causes. Now for the most important, most empowering part. What can we actually do about it? Let's talk diagnosis and management.
So, to see how diagnosis works, let's look at a condition called de Quervain's tenosynovitis. That's a mouthful, I know. It's basically an inflammation of the tendons that control your thumb, and it causes this sharp pain right on the thumb side of your wrist. It's actually really common in women, especially new moms, from constantly lifting and holding their baby. So how do doctors figure this out? Well, there's a really simple test called the Finkelstein maneuver, and you can even try it right now. Just follow these steps. Tuck your thumb into your palm. Wrap your fingers over it to make a fist, and then gently bend your wrist down towards your pinky finger. If you feel a sharp pain along that thumb side of your wrist, that's a positive sign for de Quervain's. For those more chronic issues like hand osteoarthritis, simple, regular exercises can make an absolutely huge difference. Research shows that gentle movements like these are amazing for keeping your joints mobile, building up a little strength, and really helping to relieve that pain and stiffness. Here's the big takeaway for this section. For most of these conditions, there are clear steps you can take. It almost always starts with the simple stuff, changing how you do certain activities, maybe wearing a splint, or using anti-inflammatory meds. And if that doesn't do the trick, there are other options, like steroid injections or even surgery that can bring a ton of relief. Our hands are just so central to everything we do, to how we experience and shape the world around us. Really understanding the signals they're sending is the absolute first step to keeping them healthy and strong for life. So the real question is, how will you listen to and take care of yours?